As soon as next week, the province's vaccine supply could be dried up. Good evening, I'm Tara Overholt. By day's end, roughly 50,000 Albertans will have received the first dose of the vaccine as the pace to inoculate ramps up. However, a shortage here and right across the country is a real concern.
Next week, we're projecting to be short at least 20,000. It could be significantly more based on our pace of inoculations.
By month's end, Premier Kenney says AHS could be inoculating 50,000 people a week and is pointing the finger at the federal government for the supply issues.
The federal government signed exclusive contracts for Canadian supply of vaccines, so Alberta cannot legally procure its own separate supply, at least not with respect to the 3 vaccines currently being used globally.
Meanwhile, the province has expanded its vaccine priority eligibility list to paramedics and emergency medical responders. Today's COVID-19 numbers from the province show a low positivity rate, 6.1%. From close to 10,000 tests, the province identified 639 new cases. Active cases for the province at close to 14,000, with Calgary accounting for about 5,000 of those. 23 more deaths reported in the past 24 hours, bringing Alberta's total to 1,307. More than 800 people are in hospital, with 130 of those in the ICU. Alberta Health is also keeping tabs on adverse reactions from the vaccine. So far, there have been 7.
Most were minor, such as swollen lymph nodes, diarrhea, or a rash. There were 3 that involved an allergic reaction. None of these were determined to be anaphylactic reactions.
Hinshaw says this is on par with what clinical trials and other commonplace vaccine rollouts have seen.